Welcome to Skeletal System Part 2. We're going to be talking about the skull, the different bones and landmarks of the skull. So, what do we see here? We have bony protection around the brain, and we can see pretty easily that it's multiple bones that make up this whole skull. And some of them are pretty familiar, like the mandible and the maxilla. And just in case though, I'm going to quickly go through all of them, and then we'll go into a little bit more detail on each of them. So, I don't know, let's just start with the frontal bone. Okay, there's the frontal bone, and the bones of the cranium, they come together with a fibrous, dense fibrous connection called a suture that holds them together. It's not quite bone to bone, and of course these sutures are not very solid when we're just little babies, and there's a little space, in fact, right? So here's the coronal suture between the frontal and the two parietals, the two parietal bones, and there's a sagittal suture between the left and right parietal bones. So in this segment right here, this little junction between the frontal and the two parietals, we have in babies a soft spot there, right? And we call that the anterior fontanelle. Fontanelle being a little fountain, and there's going to be a posterior fontanelle as well in this region here. Oh, upside down. There we go. Between the parietals and the occipital. So, and this suture is the best one for naming because it's fun to say, lambdoidal. So this is the lambdoidal suture around the margins of the occipital bone, well, between the occipital and the parietals. And it was called that because the Greek letter lambda looks kind of triangular. Somebody said, hey, it's like lambda. So oid, we'll be seeing a lot of oids when we hear about bony landmarks, and oid is basically, it's like something. So this lambdoid would be like lambda. Lambdoidal, old, just makes it into an adjective. So lambdoidal suture. So sagittal suture, coronal suture, and what else to say about the frontal bone? Not much, except that it's, you know, right here prominent. We get our eyebrow ridges on it essentially, and you can see that it forms the upper roof of the orbit, one of the cavities, the orbits for the eye. And there is a little supraorbital foramen there that's not really showing up. There's a little hole for a supraorbital nerve that exits there, but anyhow, let's move on. Two parietals, one occipital bone, and the occipital bone has a very prominent hole in it. Gee, I wonder what that's for. So the base of the brain ends and the spinal cord begins right through there, and a hole through a bone is called a foramen. So there's a foramen there, there's a foramen, there's a foramen, and it's not the only word we use for a hole, but that's essentially all it is. And since this is a really big hole, the biggest one that's the foramen magnum, and on each side of the foramen magnum we have this occipital condyle. A condyle is an articulating surface that's kind of knuckle-like, condylar, condyloid, knuckly like. So so the foramen magnum and the two occipital condyles. Having two occipital condyles is a mammalian trait. Birds and reptiles just have a single occipital condyle. But this is articulating with the first vertebra and allows you to have this up and down, yes, motion. Anyhow, so that's the occipital bone. We'll talk about it a little bit more, some other landmarks. Well, maybe while we're here, if I can turn things. There you can kind of see the spine and the occipital spine. You can feel this, or at least I can in the back of my head, feel a distinct spine there, and there's kind of this nuchal ridge or occipital ridge there. The nuchal ligaments, muscles of the neck basically are attaching back here, and you can you can feel that. Okay, beneath the parietal we have a temporal bone on each side, and you can see that the temporal bone is connected to the zygomatic bone, and that together they form a zygomatic arch. Temporal bone contains the inner ear, the middle ear, and the external acoustic canal, or meatus. I'm going to hide the ear cartilage here, and so we can see the opening of the ear canal there, and so that opening is called a meatus, opening to a canal. So the external acoustic meatus goes into the external acoustic canal. The temporal bone has different portions to it. This big flat portion is called the squamous portion. Squamous refers to kind of like the shape of a leaf or a scale. Snakes and reptiles are called squamates. There's a mastoid portion. This is the mastoid process. So a process is anything that's jutting out from a plane, kind of, on a bone. So here's a process called the mastoid process. And just like the word mastectomy, it is referring to breast. So some anatomists thought that this process looked breast-like, and so they named that the mastoid process. And there's another process here. It might be more visible if we remove some of these ligaments. This is the stylohyoid ligament. Remember, there's our hyoid bone sitting floating in the throat there, not attached to any other bones, attached to some of the muscles for swallowing and moving the base of the tongue down. But there's a ligament attaching it to, it's called the stylohyoid ligament. Here's the hyoid. This is the stylus process of the temporal bone. So let me just hide that and hide this other ligament that is attached to the stylomandibular ligament. So a connection between the styloid process and the mandible. So as mentioned, this sharp little projection there on the temporal bone is the styloid process. And stylus is a writing instrument. So oid means it's like something. It looked like a pen, the tip of a pen to somebody. So they called it the styloid process. And in a real skull, like in lab, this often breaks. That's pretty fragile. So in a plastic model, it's usually there, but it's also not very pointy. Okay, so there's a left and right temporal bone with a mastoid process, a styloid process, also forming part of the temporomandibular joint. So there's going to be a mandibular fossa. If we hide the mandible for a second and hide this joint capsule, okay, then we can see the little fossa, which is a scooped out area, temporal fossa, or sorry, mandibular fossa on the temporal bone. And let's bring everything back here for a moment. So if we look at the mandible, we can see that the coronoid process of the mandible fits, or condyloid process, like a knuckle, condyloid process of the mandible fits into the mandibular fossa of the temporal bone. Okay. Let's show everybody again. Cranium. Okay, all the bones of the cranium. So I've been trying to first go through the bones of the cranium, and we got the frontal and the two parietals. We got the occipital. We got the temporal. And so we're just looking at bones of the calvaria, which, well, bones of the cranium. Let's get the whole cranium here. So we have some other bones of the cranium that are harder to see. Well, we have sphenoid and ethmoid bones that I want to show you, and that might be it. Let's go to the ethmoid bone, which is let's remove the frontal bone, and we can, and let's move the parietal out of the, now this is easier. Let's just hide those parietals. Now what do we have? Okay, so I'm looking at the skull from back view. There's our occipital bone, there's our foramen magnum. So now we're looking at the floor of the cranial cavity, or where where the brain is sitting. And this is temporal bone. So the temporal bone does jut inwardly and forms part of the lateral walls of the cranium as well as the floor of it. And this weird bat-shaped bone is called the sphenoid bone. It has some cool landmarks. Most prominent or easy landmark, I think, is the sella turcica. Let me just hide this temporal bone on one side here. We can see this looks kind of like a saddle. There's the back of the saddle. There's where the rider would sit, the cowboy. So the Turks had high-backed saddles, and so this is called the Turkish saddle, but of course it's not in English, so it's sella turcica. The sella turcica is, who's the cowboy that's riding in that saddle? It's the pituitary gland. So the pituitary gland is sitting right there. And I'm going to hide the occipital bone here just so we can really, let's highlight this and hide everything else for just a moment here. And you can see that there's an opening, a foramen, and there's an opening, and there's an opening, and there's an opening, there's an opening, and there's an opening. And if we attach the other bones, we'll see some other kind of openings. So lots of foramina in this bone. And there's the anterior view of the sphenoid. Very strange looking bone. I like being able to move it around like this. This is pretty wild. And so it kind of looks like wings, and so we have a greater ala or wing and a lesser wing of the sphenoid bone. But just quickly, I wanted to point out the pituitary gland sitting in there, and it's connected to the rest of the brain with a little stalk. And then right around that we have two nerves, optic nerves, going out to each eyeball. So let's bring back everything else here. Well, maybe not everything else. Let's hide. So if I highlight that sphenoid bone, now we can see better that the foramina, there's an optic canal, and there's an optic canal. Let's get the whole skull though, and then try to highlight the sphenoid bone. There we go. So with everything in place, it's harder to see some of this, but that's the optic canal. So the optic nerve's coming in at an angle, and to the right eyeball comes the nerve from the left side of the brain, and to the left eyeball comes the nerve, they're crossed. There's a crossing of those nerves right above the pituitary gland. It's called the optic chiasmus, or cross. And so enlargement of the pituitary gland will actually put pressure on the optic nerves, and so troubles with vision, especially lateral vision, may be indicative of a problem with the pituitary gland. So anyhow, so yes, the sphenoid bone is kind of difficult to visualize because of its location, but just play around, look at it from different angles. And I'm a little disappointed that our software doesn't show us the different landmarks as we click around for this sphenoid bone, but that's okay. It's awesome software anyway. Now let's go into the nose, and how do I turn? Come on. It's a little difficult to get the controls here. Let's take off the cartilage of the nose here. So we have the lateral nasal cartilage and the greater alar cartilage. Alar referring to wing again, so the wing of the nose is the alar cartilage there. So looking into there, you can kind of see the back of the nasal cavity. You can see the sphenoid bone playing part of that, and then there's this bone playing part of that as well, and difficult to visualize. That's the ethmoid bone. But if we take off the frontal bone and then highlight that ethmoid bone again, now we can see it a little differently. Let me hide the parietal bones as well. And let's go, I'm used to looking at it kind of this view with the sphenoid bone here, and then we've got the ethmoid bone right there. And it's interesting to me, here's a case where they are letting us click on some of the landmarks, and I don't know why that is. They're treating them separately. I've never been told that they're separate bones. I don't think they are, but the cribriform plate is part of the ethmoid bone, but they're letting us click on it separately, which is kind of weird. And how come I can't quite bring that into the center of the screen? Ah, there we go. Right click does it. Okay, so the ethmoid bone, I can zoom in here, the cribriform plate, it looks, there are a lot more holes than that. It looks like a sieve. And what happens, the olfactory nerve has two bulbs that sit here on the ethmoid bone, and then little spaghetti-like nerves going through the holes of the cribriform plate into the upper nasal cavity. So our whole sense of smell is coming through the cribriform plate of the ethmoid bone. So there's the rest of the ethmoid bone, and this part's ethmoid bone too. So they're letting us click on what's called the crista galli. Crista referring to a crest, galli referring to a rooster, like a galliform. So there's the rooster's comb, or the crista galli, and it's the upper part of the ethmoid bone. There's a piece of meninges covering around the brain that attaches here. So the two parts of the brain, they're divided, two hemispheres of the cerebrum, and there's a scythe-like slice of, there's a curved slice of meninges that goes down between them. We'll get to that when we talk about brain, but attaches to the crista galli of the ethmoid bone. And if you look at the ethmoid bone further, finally getting this a little bit better here. Worrying about the navigation. Okay, let's look into the nasal cavity here. Here's ethmoid bone. I'm going to remove nasal bone, which is a facial bone. It's not, and I'm going to remove at least one of the maxillae so we can get a better look. Here is the septum, or the dividing wall of the nasal cavity, and a lot of that septum is cartilage right there. So let's just remove that septal cartilage. So that middle part of the nose that you can feel, you know, this dividing portion, all that front part, that's cartilage. So whoosh, gone. Now we've just got bone left here. And so what's this? This is the perpendicular plate of the ethmoid bone. Okay, so the perpendicular plate of the ethmoid bone, and here is the crista galli of the ethmoid bone, and these things are kind of related. Let me remove one more thing here. This is the lacrimal bone. Now we're seeing ethmoid bone very nicely here, and so the ethmoid bone does include this. This is the perpendicular plate of the ethmoid bone. Here's the rest of the ethmoid bone along with the crista galli. So if you've ever heard about smashing an animal in the nose and driving a bone up into its brain, or a person getting hit that way, it's true that the perpendicular plate of the ethmoid bone can break through the cribriform plate, and it's one with the crista galli. So the whole thing can kind of spear the brain a little bit. And even if you don't damage the brain, just breaking this crista galli, you're going to start to leak cerebrospinal fluid into the nasal cavity. So if somebody's had an injury to the nose and they've got this clear fluid leaking out, it's like, well, is that mucus? If it's not sticky, oh, it could be cerebrospinal fluid. And our concern then is not so much the fluid leaking out as the fact that bacteria could get in. So you know, this is supposed to be a sterile space here. Okay, so that's our weird ethmoid bone. We're not quite finished with it. I may remove another maxilla here, And so there's ethmoid bone. Here's the perpendicular plate of the ethmoid bone, which, since I can, I'm going to hide it for now. Oops, nope, I don't want to hide it. I wanted to show the whole ethmoid bone. Let me remove the other lacrimal bone there. Okay, so here we have, let me just get the whole ethmoid and hide others. That's easier. Okay, so the other thing I wanted to mention was this part. It looks kind of hard to see that it looks like anything, and it is hard to see in the nose even, but could you kind of imagine that maybe it looks like a shell? Because that's what they call it. It's a concha, a shell. Let me see if I can hide the, no, I can't hide just that part. I get the whole ethmoid bone or none of it. But there are actually, there's a superior nasal concha or turbinate and a middle nasal concha. Now if we have a superior, we're going to have an inferior someplace, but the inferior nasal concha is its own bone. So these bones are called turbinates or conchae. They are part of the ethmoid bone for the superior and middle, and then the inferior nasal concha is its own bone. All of them are covered in mucous membranes. They help warm and moisten the air. And in terms of weird anatomy, I had a student who was able to poke her tongue above her soft palate and stick her tongue into her nasal cavity, and she could feel her turbinates, her conchae. She could feel with her tongue these bones. Crazy. And one thing that I had never thought of, she said, do you know when you have a stuffy nose and you can't breathe and you try blowing your nose and really nothing's coming out? She checked with her tongue in those conditions, and the mucous membranes here are just totally swollen and the space is just kind of blocked. So it's not that it's full of mucus necessarily, but just that the membranes themselves are so swollen that you can't get air through very easily. So weird anatomical trick of a student, and a little bit of interesting knowledge thanks to that. So back to the whole skull. Let's go ahead and remove the cartilage again. Hide. Oops. Hide. Taking away cartilage. And I'm going to take away this cartilage, the septal cartilage. And then we should be able to see right there the inferior nasal concha or turbinate. Either one's fine. So lower or inferior nasal concha. So the middle concha can be seen there, and the superior concha, I don't know, is that it? You can't visualize it usually very well, but the superior and middle are part of the ethmoid bone. The inferior nasal concha is its own bone. Okay, but now by clicking on that instead of this, see, if I click on this, then it says, oh, bones of the cranium, you know, what bones are actually in touch with the brain in some way. And I think we got all of them. Let's just review quickly which bones touch the brain in some way. And we'll just remove them as we go. So there's one frontal, two parietals. So I'll hide one side at least. Two temporals. I'm going to remove the ear cartilage just to get that out of the way. Okay, so two parietals, two temporals, one occipital, one sphenoid, one ethmoid, and voila, I think that's all the bones that make up the cranium, you know, the brain case. Like this one here is the vomer, and it meets up with the ethmoid bone to form that septum, but it doesn't touch the brain itself. Let me see if I can pause this. I'm getting a call. I don't think there's a pause. I'll just ignore the call. Okay, so those were the bones of the cranium. So let's go back to the whole skull. Oops, let's do just the skull. And let's click on just the facial skeleton on the right side. Well, that's a little misleading. Okay, but we talked about temporal bone. Here's zygomatic bone, and together they form a zygomatic arch. You can see the zygomatic bone also forms a portion, the lateral portion, and maybe lateral inferior portion of the orbit. Here's the maxilla, which forms the inferior and medial portion of the orbit. And look at that, infraorbital foramen. Right, there's a foramen there, so we got a nerve coming out there. There's a supraorbital foramen that doesn't show up really well here, but that infraorbital foramen shows up pretty nicely, and because there's a little canal there for a nerve passage. Look at that, branch of the trigeminal nerve, I believe. Okay, we also see, if we look from this angle, where our tears will go. All right, oh, tears into the nasal cavity. Well, what did I just click on? I hit a nasal concha in there. I'm trying to click on the lacrimal bone, which is that, and there's another lacrimal bone here, and so they form a margin of the lacrimal canal where your tears go down. And these bones are actually quite fragile. If somebody's attacking you and you pinched hard like that, you'd break their lacrimal bones. I don't know how much that hurts, but so lacrimal bones, nasal bones form the bridge of the nose, and let me just say, humans have really wimpy nasal bones. If you compare our nasal bones to those of your dog, they're pretty insignificant. I guess cats have pretty small nasal bones too. Let's see, the maxilla holds the it's the upper jaw, holds the teeth. Attaches to the zygomatic bone. The mandible, it's kind of weird because there's a left and right maxilla, and in studying other mammals, it's always called a left and right mandible, but in humans, it fuses so completely that they just call it one mandible. They just say there's only one. And here's mental foramen. So two foramen would be mental foramina. And this is the mental region there, the chin. This is the angle of the mandible. And let's just hide or fade everything else. This process, somebody thought, hey, it looks like the beak of a crow. So we're just going to call it Coronoid process. C-O-R-O for a crow. It's supposed to be like a crow's beak. Okay, and so this is condyloid process. And now I'm having a mind blank as to what this little area is. But this whole portion jutting up from here, the jutting up part is the branch or the ramus of the mandible. So the ramus of the mandible branches out further to a coronoid process anteriorly and a condyloid process posteriorly that fits into the mandibular fossa of the temporal bone. Okay, that's a pretty decent tour of the skull. I like that I'm kind of figuring out better how to move things around here. You can, I didn't do a very good job highlighting, but there's C1, the atlas that articulates with the occipital condyles of the occipital bone. Oh, look at that, look at that. There's the Nuchal Ligament that happens to be here. So attaching to the spine of the occipital bone there. This Nuchal Ligament is pretty tough, and it's just for muscle attachment, and it's going between the spine of the occipital bone and the spinous process of C7. And this is not unique to humans, and so I'm just going to tell you a little tidbit about it right now, and that is, you can imagine if you were, say, a sheep or a horse with a longer neck and trying to support that neck and head. Let's see, can we rotate it? How can I rotate? I'm trying to get this guy into a more sheepy position, but anyhow, that ligament is really strong in like a horse or a sheep or a goat, and I don't know why they called it this, but in Old England they called that the paddywhack. And so when they would butcher an animal, here would be this tough tendon, and or ligament rather, because it goes bone to bone, and they would cut that out and I guess dry it out or just give it to the dog. Knick-knack, paddywhack, give a dog a bone. That's apparently a thing. So the nuchal ligament is the paddywhack, or so I've been told. I should verify some of these things. Okay, I'm trying to think of critical landmarks that we've missed. I guess as we come to things that that involve the landmarks, then we can learn them again. But we have, I believe, 8 cranial bones, 14 facial bones. I didn't mention the vomer very well. Let me go ahead and find the vomer again. And oh, and the palatine bones I didn't get, did I? So I'm hiding the septal cartilage, and now then we have ethmoid, the perpendicular plate of the ethmoid bone, and boom, there's the vomer. So you can see that it's attached to the septal cartilage and to the perpendicular plate of the ethmoid bone, and it means plow. And if we fade others and we turn the view, you can see that it's shaped like a plow, and there it is, it's very much shaped like a plow. So that's what vomer refers to, and you can see it best on like a skull model or an animal by looking, from the backside, inferior view, looking into the nasal cavities, because from this view, that whole septum from this view is vomer. So it's the inferior portion of the nasal septum. And hey, look, there's an inferior nasal concha from this view. So this is the view. There's the hard palate right here. This is also a good view for that. 2 palatine bones. Let me fade everything else. The palatine bones are these kind of weird L-shaped or inverse L-shaped. They're L-shaped bones, and they form a little bit of the hard palate. So this is palatine bone for the anterior portion of the hard palate, and sorry, did I say that right? I didn't. The maxilla forms, there's a floor of the maxilla that forms the anterior portion of the hard palate, and then the palatine bone forms just the posterior portion of the hard palate, and then the soft palate extends past that, right? So hard palate is mostly, well, I'm not able to click on it, mostly maxilla and then palatine bone, the palatine bones together. All right, I think now we've got them all for all the facial bones, all the cranial bones, and all together they form the skull. The only one that's freely movable is the mandible, right? So back to the whole skull there, only the mandible is it's the only freely movable bone, in the skull. And there's the hyoid bone, which not a whole lot to say that I've already said. The only other tidbit to add is that, you know, that's the bone where if somebody gets strangled, oftentimes the hyoid bone gets broken, so it's evidence of strangulation. All right, I think we're going to call that good for skull, okay? And I'll do another one on the rest of the axial skeleton, and then we'll probably do 2 parts on the appendicular skeleton. So sorry to be long-winded. I'll